Before we get started, please remember this podcast is for general educational purposes only. We're not providing medical advice, diagnosis, or treatment. Always consult your own healthcare provider about your care. Welcome to Fertility Nurses Unfiltered. 2 nurses, 1 mic, no bullshit.
I'm Ashlee LaRue, fertility nurse and founder of Fertilities.
And I'm Laura Wepler, fertility nurse and founder of Navigating Fertility with Laura.
You got questions, the internet has a lot of opinions, but what you really need is 2 fertility nurses who aren't afraid to tell the truth.
No scripts, no sugarcoating, just honest, evidence-based nurse-to-nurse conversation. So let's get into it.
Hey everyone, welcome to this week's episode of Fertility Nurses Unfiltered. I'm so excited to be with you all again this week and obviously with Laura. And we're really excited to continue this week's podcast. And this week we're going to be talking about what's happening in between appointments. What's happening, we're going to dive into what's happening at the clinic and give you a little insider's perspective of kind of what's happening in the clinic. Obviously talk about real life, what's happening outside of the clinic and what you all are experiencing, and kind of bring that home and wrap it up into talking about support and helping and advocating and all the things you're probably feeling. We're going to dive into all of that and talk about realness, what we're seeing in the fertility world right now. So yeah, really excited to be here and really excited to dive in with Laura for this week's episode.
Yeah, and I'm really excited about this episode because I think, we have that perspective of what it's like to be in the clinic. We know, we hear what our patients are frustrated about, and we understand where those frustrations are coming from the way that the clinic operates. And some of it is really truly like out of our control and in the hands of the clinics themselves and the operations overall in the healthcare system. I mean, that could be like a whole topic in of itself, like about our healthcare system in the US and how everybody is stretched thin, but I won't go off tangent today. My goal today is not to ramble on. So with that said, I'd love to kind of just start with, what, Ashlee, you've been in the clinic more recently than I have. So, and I know I think a lot has changed too with COVID. And
Very
the way
much.
that clinics operate. But I imagine a lot of the day-to-day operations is the same in the way that, when I was in the clinic, it was the very first thing that you did when you came in is any monitoring that was going on in the clinic. You were maybe seeing patients who had questions. Every clinic operates differently. I've worked with clinics who the nurses or the ultrasonographers, they have an ultrasonographer. I've had it where all the docs do every single ultrasound.
Yep.
And then they meet with all their, the nurses meet with the patients afterwards. So I think it is nuanced, but that's usually the first thing from 6:30 in the morning until 9 is everybody's coming in and getting their ultrasound and blood work.
Yeah, absolutely. And you're 100% correct. I think everybody's experience is going to be very different in how your clinic operates. But morning monitoring is definitely the biggest piece early, first thing in the morning. When everybody's getting there, it's kind of getting everyone in for blood work, ultrasounds, anything happening in the morning. On the procedure side, we're bringing in egg retrievals. So the surgery is bustling with doing egg retrievals. The lab's getting up and running. Front desk is taking a ton of calls because the phones are now up and running. And overnight, you've probably had all these questions and the phones are open now. So they're getting a lot of phone calls. So the morning time is definitely the busiest time at the clinic in a lot of cases. And for everyone is going to be different. Nurses are sometimes going to see you after monitoring or when you're in the office, and sometimes they won't, and you're going to hear from them later. So some nurses may be seeing patients in the morning. Some nurses, they're tackling those voicemails and those phone calls, those portal messages. Sometimes it's hitting the ground running and calling pharmacies first thing in the morning, dealing with medication stuff.
Prior authorizations,
which we already know is everyone's least favorite part, or one of their least favorite parts, is dealing with pharmacies and medications and insurances. And it's a lot. So you kind of hit the ground running first thing in the morning, and it's trying to get back to as many people as possible, but it's also triaging those people. I think that's one
Yes.
of the things
Yes.
with nursing is we very much have to triage, like, okay, this is an urgent call. This person's pregnant. They're maybe having some spotting. I need to call them right away.
Right.
This person has a question about vitamins that probably can wait a little bit. And so this is not to give excuses or the reason why like you're getting delays in those things.
Right.
It's
Why you're not hearing back right away.
yeah,
Yeah.
we do have to, sometimes we just have to prioritize things sometimes. And it's not that your question is not important or urgent or relevant or any of those things. It's just we have to hit those certain things first and early.
Yeah.
So yeah, definitely morning's the busiest, no matter what your nurses are doing, what the staff's doing. It's definitely hitting the ground running because yeah, the clinic's been closed for a little while and now we've got to get things up and running.
Well, and you're also, preparing for the doctor's schedule that day, right? So whatever, we used to prepare the doctor's schedule. Like I would write notes, at least for one of the physicians I worked for, we would have a list of all the appointments coming in that day. And I would have to go through the charts the night before and then that morning and make sure that there were little notes for her on like, reminding her who the patient was or what was going on with this patient, why they were coming in, what it is that they want to talk about. So you're kind of responsible. I mean, the nurses are pretty responsible for everything,
Yeah.
to be honest.
Nurses are a little bit of the catch-all, to be honest. They have to understand the full patient journey from a financial aspect, from a clinical aspect, from a lab aspect, from any outside things that we're sending out, from a pharmacy aspect and medications. It's the reason they're called coordinators. They're the coordinators of chaos at the clinic because all these different people that have different jobs, from finance to front desk to lab to all these pieces, it all funnels through the nurses.
Yes, I was thinking about that, kind of like almost like if I'm visualizing it, right? Like a sphere in the center and then all these little branch offs, right? The doctors are saying, "Hey, can you go talk, in room XYZ, can you go talk to so-and-so about this? This is here's the orders that we're going to need. Here's what her treatment plan is. Okay, now you got to go order all her medications." It's just, it's a lot. I mean, when I sit down and I really talk about it and think about it like this, I'm like, holy cow.
It's a lot.
It's a lot. It really is. And on top of that, right, you're looking at messages that maybe you got in the portal the night before, or emails if your clinic isn't on emails, or the front desk is calling you saying, "I have so-and-so on the phone, she needs to talk to you now." And you're like, "I'm heading into another room.
Yeah.
Put her on hold," right? It's chaotic.
I think it's super important to note that as much as I think a lot of nurses like things like organized and you plan out your day, like you said, like you're looking at your doctor's schedule. Okay, these people are coming in today. I need to get back to these people. You're checking the portal and voicemails and who you need to get in touch with. And then 1 hour in, a wrench comes in and your whole day is just very different. So as much as you can sit there and plan your day and like say, I'm going to get back to so-and-so by a certain time, you never know what the day is going to bring. And so I think that's one of the hard things about fertility nursing is, while maybe it's not physically strenuous, you're not running around on a hospital floor or things like that. You're dealing with a lot of different components. And as much as you can plan, the plan never goes like you hope or wish it's going to look for that day.
No, and I said this last week when we were talking, it's run like, I mean, when I got hired, I was told, I've had emergency room nurses tell me this was harder than working in the emergency room. Now, for me, that's very hard to conceptualize because I don't think I would survive an emergency room environment. In fact, I know I would not survive in an emergency room environment. But when we're talking about triaging and deciding priority of who we need to contact and what needs to take precedence, that is like an emergency room. That's exactly what they're doing in the emergency room. Whose life is on the line? That's the room I'm going to first. And so-and-so who came in with a broken arm is going to have to wait because that's not the same level of emergency as somebody having a heart attack.
Yeah. And I think one of the pieces here too, before we can kind of keep going on through the day, is back to where you were talking about like kind of the healthcare system and where we're seeing things headed. The staffing piece of it too, right? Is we're seeing more and more staffing shortages and trying to function on less nurses, but so here's like the double edge, right? We just said nurses coordinate everything. It's kind of the center of the ring. Everything's coming through the nurses. They have to know kind of what's going on with all the patients. But the less number of nurses that we have working in the clinics that are able to triage and coordinate and control the chaos, the more that chaos is felt by, I think, patients, which I think is part of the reason why our clients aren't getting responses like they'd want to see.
They feel like a number. I mean, the way we describe morning monitoring, right?
Yeah.
We're like
in and
trying
out.
to funnel people in and out because we need blood work results back so that we can have decisions by the end of the day on what's the next step in your protocol. Yeah. I totally understand that like factory feeling like a number because that is the way it's run. And I honestly don't know how else we could do that piece of it. I don't know.
What do you mean?
Like, I don't like, it's so chaotic in the mornings. I don't know how else we could pull away that feeling of like, right, people are all waiting for their name to be called so they can get in and get out. Yeah. Because there is such a high demand for fertility care. So like this is so I guess what I mean, one of the things that I talk about all the time is the demand for fertility care is so high that the fertility care system cannot handle the amount of people who actually need fertility care, right? Yeah. We don't have enough doctors. This is a huge topic at like conferences that I've gone to that the REIs are always struggling with. Like, we don't have enough doctors to meet patient demand. Yep. We don't have enough clinics. There are clinic deserts. I don't remember if we talked about this last week, but you've got, places like, I think we did. You've got places like Louisiana. I don't even know if they have a clinic in Louisiana. Maybe they do.
Maybe they do. I don't know.
But so the clinics do the best that they can to see as many patients as they can, but then that creates this system of overwhelm, right? And it doesn't allow us, I think, to do the jobs that we would like to do. Yeah. And in the way that we want to do them, if that makes sense.
No, I 100% agree. I think that's honestly like the point of having this conversation with our listeners is not to give excuses to clinics and like, why you're feeling like a number and justify that in any way, because we fully recognize that there's a huge gap in support and care, just as Laura said. But I think that's the whole point of saying this is so I think our listeners can understand that there's a gap that exists. It's not you. And most of the staff, I won't say all, but most of the staff that you're probably working with wish they could do more, wish the system was set up to help them get through the day and get through patients faster. Yeah. But they're working with what they're working with. And I think you and I both felt that when we were in the clinic we did as much as we could. And I knew nurses that were staying till 6, 7 o'clock at night, trying to get to as many people as possible, but it never ends. You spoke a second about, staffing too, and we both did. I saw a statistic one time that nurse burnout in the fertility space is number one.
I totally believe that.
Not only like, the emergency room analogy you were talking about, right? But the turnover in fertility is number one for nurses out of any other specialty for nursing out there. And I think the reason is I think this has been a systemic thing for a while. Like nurses just aren't set up for success. I think we go in as nurses wanting to help people, wanting to take care of people, wanting to have conversations with people and build relationships. I think we talked about that, why you didn't like labor and delivery as much, right? Yeah. It's one of the reasons you left there. And so I think as nurses, that's what we go in. And fertility nursing it doesn't give us the time to spend with patients the way that we wish we could. So I think that's one of the pieces. The system's just not set up. So we see that high turnover. Yes. And again, I think our patients feel that high turnover as well, because that equals shortages. It takes a while to train a fertility nurse because it is so nuanced and niche to really understand.
Yeah. Or maybe maybe a patient is working with a particular nurse and then that nurse leaves and now they have to build a new relationship. Yes. I've seen that so much. And I totally believe that statistic. One of the first years I was working in the clinics, I swear, at one point we were getting emails like weekly of somebody who had left. And we had offices, we had offices all over the state of
Yeah.
Illinois. But I remember it was like, oh my God, another nurse left.
Yeah.
And, going kind of back to what I was saying last week too, or just fertility is complex. It's not an easy topic to learn.
Yeah.
And especially if you don't find it fascinating. I mean, I found it fascinating. I think you found it fascinating.
Yeah.
But there's a lot to learn. I think
Yeah.
when I was going through training, it was like the first few months of your training, you weren't even working with IVF patients yet, because that
Yeah.
was a whole nother
Yeah.
level of complex.
Yeah.
All right. So think about it. We have this long training time to train these nurses, and then they're leaving, and then we're having to spend more time to train new nurses.
Yeah.
Right. And then, so that, I mean, and I functioned in that role too when I was in the clinic as being a nurse educator and training some of our new nurses. So now you add that in to all the other things. You know what we didn't even talk about, Ashlee? IUIs.
Yeah.
IUIs were coming in the morning. The nurses, at least in the clinics that I worked in, we did the IUIs. Our docs did not do the IUIs.
Yep.
So that
Yeah, the nurses are being pulled in a lot of different, I think that's the take home, right? Like nurses are being pulled in a lot of different directions. Every clinic is going to be different. But yeah, there's a problem. Clearly we've hit on so many topics. I feel like we could even expound on further.
Yeah. Our goal is not to have an hour-long episode this week. Our goal
Well,
is not to talk about it, but of course we will,
least-
right? If that's what we need to do. But I think the goal, right? We could. I think you and I could probably spend the next day just talking about this topic alone and all of
100%.
the issues that we see.
I think one of the things that was really interesting that you hit on is, I think we're talking about trends here, right? And we've seen certain trends and things that have happened. But one of the things you hit on early, you said COVID. Very much pre-COVID versus post-COVID, nursing and fertility care has changed a lot. I mean, I don't know about you, but we used to bring our patients into the clinic, and we would have an hour-long nurse consult, one-on-one with you, and we
before
would teach
IVF.
you. Before IVF, we would teach you medications. We would sit down with you do you understand your calendar? Do you know how to order your medications? Here's the protocol. Here's what that means. In depth. And then you got to know your nurse, and we had one-on-one nursing, right? Where we worked, you worked with a doctor, and that was your patient load was a specific doctor, which a lot of times they still do, but a lot of times it's teams now.
Yeah. We used to split the alphabet. And so it would be like me and another nurse, and I would take the bottom half and she would take the top half. And I got a lot of, and this was even pre-COVID when I was in the clinic, I was even getting pushback at that point that the system that I was in at that time, they wanted to move away from that. They wanted to work in teams. So we had like color pods of nurses. And I got that from an operational perspective. But that's not, in my opinion, was not right for the patients. I think you and I are both very aligned that one-to-one nursing is really what's best for the patients. So sorry, I just totally went off topic there.
No, it's 100% true. I think a lot of the clients that we see are craving just somebody, that go-to person that understands them. They're not having to repeat their story 15 times and talking to different people. It's like, you get it. You know what's going on. You ask a question, boom. Like, you already know that person. And it's building that trust.
Yeah.
I think a lot of our clients have lost trust in clinics. And this is just one piece of the reason potentially why, but I think that's one of the pieces is they're not talking with their doctor very often. They're not talking with one nurse. They're talking with multiple different people, and you never know who you're going to get. And that can be really hard at a very vulnerable part of healthcare and trying to build your family. But yeah, the reason I was bringing that up is like the trend that we're seeing is we're getting more away from talking with your nurse or talking with people. It's portal, it's send an educational video, which is great too. I like video for convenience, and some people learn better on video and you're able to rewatch something. So I think there's definitely a benefit of that. But we're getting further and further. I think we mentioned this last week too. We're getting further and further away from that one-on-one talking to somebody that you trust and really feeling that connection with your clinic. And I think pre-COVID, we did a little bit better job at it. There were still some things we needed to do better. But I think post-COVID, it's even more and more tech, AI, videos, portals, things like that. And I think our clients are feeling it.
Yeah. Well, and I think part of this shift too is healthcare in general. We're seeing more telehealth, and I think a lot of that is for convenience. I'm like dating myself here, right? But I think life is gotten so much more fast paced.
Yeah.
Especially over the last decade, right? I feel like the majority of us are just go, go, go all the time, right? And so to be able to fit things in, where I don't have to drive somewhere, I can just get on a video call.
Yep.
It's more convenient. And
Yep.
so I think there's some benefits to this more of a telehealth experience in fertility care.
Yep.
Since COVID. But I also do think it's a huge detriment when we're talking about a population of patients who are going through an emotionally, traumatic, I think that's an appropriate word, process. And I'm trying to conceptualize, I've never worked in oncology, but I can't imagine it's the same way, right?
Yeah.
I mean, I don't know, but
Yeah.
I imagine maybe there's a little bit more hand holding there, or maybe I'm being naive. I just think, I'm always talking about this is an expensive process for a good amount of people. I think you're going to hear me say that a lot because it's something that's been very forefront for me in some of the spaces that I've worked in the fertility sector is how expensive treatment is for the majority of the US.
Yeah.
And you don't have access to, you're paying for this and expecting an outcome and you're getting no guidance, or you're basically being handed a set of materials to go home and learn it and figure it out without somebody teaching you. And I just told you that nurses get like 6 months of training.
Yeah.
But you as the patient are supposed to just like go home, read these materials and understand it. And not to keep rambling on here, but to that point, one of the things that a couple people said to me after last week's episode is there were some terms that you and I used that they were like, what does that mean? And I'm like, oh my gosh, you're so right. You and I are used to talking that way because that's like it's the language that we speak.
Right. Yeah. No, 100% true.
But patients aren't. And then we hand them a packet of stuff. And I get a lot of questions all the time from people that I'm working with, like, what does this mean? We forget. I think it's very easy for us to get. Like, I use the term REI very naturally.
Yeah, I do
Somebody
too.
asked me today, and I was like, reproductive endocrinology and infertility specialist. It's a mouthful, but that's what that means.
Yeah.
So, and on that note too, if Ashlee and I are ever having those conversations and talking about something and you're like, what on earth are you talking about? Like, shoot us a DM, ask us, we'll address it in the next episode. So side tangent, done. Back to you.
No, I think you hit on so many relevant points. It's there's so many things that are happening that are good in the fertility space. I think there's more eyes on fertility. I think there's more money being put into fertility, which increases people paying attention to it. It increases research that we can do to improve outcomes and things that we're doing and using to get people better outcomes. But on the same token, more money going into it can also be a detriment to it as well, because people that are putting money into it are dictating the way certain things are being done. And I think that's something that we're seeing as well. And it's a double-edged sword, and we could argue both sides because we want better research. We want more advocacy. We want people paying attention to it. We want more states to mandate insurance coverage. We want more insurance coverage. We want lower medication rates and things. So yeah, there's a lot of good that's come into some of these transitions that you and I are talking about. But I think from what you and I deal with on a care perspective, from an education, from a clarity perspective, we're getting further and further away from high touch support and care that our patients deserve. Right?
Yeah. Yeah. And I think, I think just to step back for a second too, and I think you kind of just said this, the goal of this discussion that Ashlee and I are having right now is not at all to bash clinics and the way that they operate. No, that cannot be further from what we're trying to do
100%.
here. I think what you and I are trying to do is shed light for patients who are feeling overwhelmed by the system and feeling uncared for and feeling like a number. And we're trying to say it's not right.
Yeah.
It's not right the way things are being done, but this is why. We understand why they're being done that way. I think a common thing that I hear, and I'm sure you do as well, is I never get to speak with my doctor.
Yeah.
I'm always hearing from the nurses.
Yeah.
And that goes back to that theme of nurses being at the center. A lot of the communication that patients have with their doctors is through the nurses. It's like a telephone system.
Yeah.
Right?
Yeah.
It's like the patient asks us, we go to the doctor gives us an answer, we take it back to the patient.
Yep.
And again, we're talking about how pressed we are for time, physicians too. And then you add on to their plate, they have to keep up with the latest research.
Yeah.
They're going to meetings and conferences and staying up to date on all the latest technology. And they're working with the laboratory and they're working with the nurses. So they're extremely stretched thin as well.
Yeah. And they're trying to see as many patients as they can
in a system that needs more REIs.
In a system that needs more doctors. So it's this like cyclical thing. Like people can recognize it. I think our doctors recognize it. Our nurses, people in the system fully recognize it, but it's how do you make those changes? You can't just snap your fingers and have another doctor appear to open up and you're not, our patients aren't on a waiting list any further, or, you don't have to wait 2 weeks, 3 weeks to talk to your doctor and get on a phone call with your doctor. So I think we're in this, like, fertility is growing and the fertility care system, like we haven't figured out the best way to provide quality care to patients. And fertility is very different, right? Like it's not walking into your doctor's office and you have a cough and they're going to give you a prescription and you walk out and you probably don't have as many questions as long as your cough goes away.
Right.
That's not what fertility care is. It requires, and our patients deserve, more hand-holding, more education, more time, more questions answered. And the system is not set up for that. And exactly what Laura said, like why we're having this conversation is so I think it's important to talk about it and to bring light to it. And so everybody can just sort of be on the same page, and it's not right or fair, but it's the reality of where we're at right now. And so how do we do better as clinicians? But how does a patient navigate that, which I think we're going to get more into. But I think we can sort of wrap up like our day in a nursing world. I think we've touched on a lot of it. I think morning monitoring, chaos is happening. Midday, it's a lot of just like organizing the morning. It's a lot of, again, portals, getting back to people. Yep. It's a lot of being on the phones with pharmacies and ordering meds for upcoming cycles. It's calendaring cycles that are coming up and getting them on the schedule.
Yeah, that's actually a great point too. Is
it takes time.
Spend a lot of time mapping out, especially like frozen embryo transfer cycles. It's like the patient wants to do it on a specific day, or they need it to be with their doctor at the specific time, and so then you're like counting out days on a calendar. Kind of miss those days. Yeah, no, excuse me. You're 100%. Yeah. Yeah, that's like a huge component of it too that
and that takes time. Like you literally have to sit in front of a calendar and say, okay, when do they get insurance, PA? When can they get their meds? And when can the transfer happen for the lab? And all these pieces are coming in and you're looking at and the patient wants to do it on this week or this day. And then this doctor's out of the office, and it's all those components in your calendar that takes time. But then a phone call comes in and someone's interrupting you for something else. And so, the afternoons are a lot of just trying to get through these different pieces. And then obviously later in the day is for the nurses specifically, are calling and sending portal messages with same day results.
With results. Yeah.
Yeah. Yep. So it's
and waiting too, for patients who are triggering, waiting from the lab to hear what those times can be, right? Because it's so specific when you take your trigger shot to what then your time is to be in for your retrieval. And we had to wait for the laboratory to say, okay, they need to know from the docs how many people are triggering that day, right? Because the docs are going through and they're reviewing the patients who are in the middle of an IVF cycle. I'm sure I'm saying terms right now that people are probably like, what are you talking about? So I'm going to try to be really mindful of that right now. So we're waiting for results. Then we're waiting for the docs to make decisions on those results. Then we are waiting for the laboratory to say, hey, based on this number of retrievals that we're going to be having in 36 hours, 48 hours, these are the times that you can give them. And then they're scheduling. And then we have to go put that into the messages or make those phone calls.
Yeah. Yeah. And so I think as you're hearing us say all of this, it's not just here's your results, here's your instructions. It's here's your results. Doctor has to review the instructions. If it is something more complex, like a trigger, we're adding meds or doing something, then we've got to get the lab involved. So there's like 2 to 4 people, surgery centers involved, 2 to 5 different departments within the clinic are now collaborating to get you one set of instructions that your nurse is getting back to you. Mm-hmm. I don't think we talk about that a lot enough about like the collaboration between all the different departments having to come together. But I think one of the things we don't talk about enough with same day results is we're gambling a lot with those same day results, right? And what I mean by that is lab equipment goes down, right? I don't know about you, but like there were times where there would be labs down and we couldn't run samples and we were scrambling to either fix the machine or we were sending it out to like Quest or LabCorp, which takes time and you got to get the requisitions for that. And so that's a lot of scrambling. So I think the same day results always stressed me out a little bit just because yes, we need the same day results to get those instructions, but as we all know, things break, machines break, things, happen, and that can delay getting results. So I think one of the things our patients and maybe our listeners experience a lot is like, I don't get my results till 4 or 5 o'clock. And
That's
sometimes
why.
even after the clinic is closed and you're like, no one called me, no one sent me a portal message. And I think explaining the reason behind it is like, we're not being lazy. It's probably something we're not telling you because we don't want to freak you out because we're already stressed about it. But there's potentially something going on with like the equipment and we got to get things up and running. And so I think that helps.
and waiting, I don't know where you were, if you had patients doing outside monitoring, but then you're like, okay, I gave this patient in order to go get labs at Quest or LabCorp. And then you're like, I put it as stat. Why am I not getting the fax? And then you're calling them and they're like, oh, we don't have the results back yet. It'll be another hour. And you're like waiting for that fax to come in. Gosh, I'm getting stressed out just remembering all of the things.
We're getting stressed out about it. And it's a lot. And I think you hit on something that is becoming more and more relevant. I think more and more patients are going out of state or at least to other clinics that are maybe a little bit farther away for their care. So they're doing outside monitoring, meaning what that means is you monitor, you do blood and ultrasound at a clinic that's not the clinic you do your egg retrieval. It's not where your doctor's at. So they just provide the information or do the scan or draw your blood, then they send it off and then your results are reviewed by your actual doctor. That's an extra layer like we have no control over, your clinic has control over. So we're tracking those results. We're trying to get those images from the other clinic. But I think that's becoming more and more of a thing. I think a lot more of our patients and clients are doing that. So I think it's really important that you hit on that's just adds an extra layer of trying to get those results, trying to get those instructions back to you. So I think all in all I think what you can hear Laura and I saying is there's a lot happening in the clinic. There's a lot of components to it. There's maybe some things out of our control. Mm-hmm. Staffing is a thing. Like we hit on so many different pieces, but I think, again, just to reiterate, I think the whole point of us talking about this, I hope you just have a better understanding of just things that are happening in the clinic, things that are recognized in the system in general that need to be fixed. And a lot of people are trying to pay attention to that and trying to fix things and work through those things. But that doesn't make what you're feeling as a patient any less relevant or important, or the fact that you deserve better than what the system is currently giving you.
Yeah. Yeah. And I think, you and I are always looking for ways like, how can we change this? Right. I think that's I think it was this year at ASRM, which ASRM stands for the American Society for Reproductive Medicine for people listening. They had a whole innovation summit this year of providers coming in, or not even just providers, not even just people in fertility clinics, but like outside, say, how can we innovate in this space and provide tools and resources for patients to make this a better experience. And I would very much love to hear, for anyone who's listening, if you have ideas, like, please send them. Is there something that Ashlee and I can build? Like, I want to know. I mean, we very much share this value and this mission of, like, we want to make the patient experience better, like, because you deserve better. Again, I'll go back. Highly expensive, highly emotional, and very little support. And so, like, how can we fill that? And you've heard us talk about all of the things that are out of our control. And I don't know, again, going back to what I said, I don't know how easy some of them are to fix. There may not be solutions for some of these problems, but there's definitely ways that we can improve the system.
Yeah, I think there's definitely ways we can improve the patient experience. I think that needs to be at the forefront of just people that are doing this innovation, like you talk about. There's so much, again, spotlight on the fertility space, which is great. But, I think there needs to be more spotlight on the experience. I think there needs to be more spotlight on the support, which I know, obviously you and I are doing. And I think this is a space where, like, Laura and I can agree that we can be very vulnerable, that we don't have the answers. We wish we did. I think we're trying to sound the alarm. We're trying to, say more and more and get it out there and have these conversations of, this is what people are feeling. This is what we're hearing from our clients that we work with. And we're trying to create something that helps with that. Are we doing that? I hope so. I think we're doing that for our clients. Could we be doing better? Potentially. We just maybe don't know what that is. And I think that speaks to what you just said of, we would love to hear from our listeners, like, now that you have a better understanding of kind of what's happening in the clinic and things that are going on, what do you wish your clinic, or somebody that could support your clinic, what do you wish you got more of? What do you wish was better? Like, we don't have the answers. Like, I would love to hear from people actually navigating fertility in this day and age, in this time, because like we've talked about, it's very different from even a couple years ago.
Yes.
It's changed a lot. And so I would, I think Laura and I both agree. We'd love to hear from people of what's missing. What would be the most helpful to support your journey?
Yeah.
Yeah.
And I want to hear from providers too, right?
Yeah.
If there are providers that are listening, like, what would help you in your day-to-day? What are things that, Ashlee, you and I know a lot of people in the fertility sector, like, you and I can't do it all alone. I would love to. Can we fix it? But, like, who can we talk to? Who can we sit down with? Like, how can we improve the space? You're going to, and that's one of the reasons that we started this podcast, right?
Yeah.
I want this to be an ongoing podcast and dialogue between providers and patients, and we will get it out there, right? I want to hear from patients. I want questions. I want to answer your questions. I want to have on speakers. I want to hear, from other innovators in the space. I want to be a loud voice.
Yeah, I think that's what one of the things we both aligned on when we connected and we talked about doing this is, how do we get out there more? How do we grow our voices to say, hey, let's talk about the real stuff. Let's talk about the stuff that we know is happening in the clinic. Let's talk about the stuff that we hear from our clients every single day. let's talk about what our patients are really feeling. And then, okay, like, let's learn from it. And
Mhm.
that's us learning from it. But then also, I hope, clinics, providers, nurses, patients, everybody is sort of like, hey, yeah, like, we can have a conversation that sometimes can be hard to have. And yeah, no one likes to talk about problems in a system or, feeling a certain way about, and no one wants to be the person, quote unquote, complaining about their care or something. But sometimes you have to. That's how change happens.
Yeah.
Change happens when you point it out, you recognize that there's a problem, and you work together and collaborate to fix it.
Yeah. Yeah. And I want to be loud too, because there's a lot of, gosh, this will be a whole episode too. Like there's a lot of bad information out there.
Yeah.
I know we mentioned that, like I'm recalling Ashlee saying that on our last episode. And how do we raise our voices above that
Yeah.
because right, we live in this day and age of Google and Reddit and TikTok, right? I think it was a couple years ago, a study came out showing that most millennials get their information, and like Gen Z get their news
Yeah.
and their medical information
Yep.
from TikTok.
Yeah.
Well, anybody and their mother can go be on TikTok and proclaim to be somebody and have medical advice. I mean, I see I see a lot of wonderful things coming out of social media, but I also see a lot of really harmful things.
Yeah.
And I see a lot of people trying to capitalize on people's emotions and, oh, I have this supplement, right?
Yeah.
This is the supplement. This is the supplement that is gonna it's gonna improve your fertility, and you're not gonna have to do IVF, right?
Yeah.
And I hear a lot of negativity about IVF too.
Yes.
And I want to address that at some point as well, because IVF is amazing. And I'm not saying that everyone needs IVF. No, if we can avoid IVF, that's always the goal. But I also think when there's voices out there that naysay IVF, I think it really is damaging to people who might actually need it, and then delay because they're hearing about XYZ or how painful it is, right? Somebody told me yesterday, they're like, I'm terrified of starting progesterone and oil because I heard it hurts for hours afterwards. And I was like, oh my gosh, no, that means we're not doing it correctly, right? Nobody wants to inject progesterone and oil. But it doesn't have to mean pain for hours. So there's like all these misconceptions. I want to draw back the curtain on some of these things and talk about it and be the loud voice in advocating. There I go with my tangents again.
No, but I think that's the whole point of like, we wanted to have this conversation very early in the podcast, is because we wanted it to be a very open topic of one of the reasons that we're doing what we're doing and doing this podcast is to be that voice that Laura's talking about, to highlight, there's problems, there's issues, to highlight that social media doesn't have all the answers, and that there's some great things and community stuff that comes out of it. But there's a lot of really bad things that come out of it. So I think that's why, I think you just hit on it. Like that's why we wanted to do this episode very early is, we're going to talk about the hard stuff. We're going to bring up stuff that maybe you disagree with, and that's fine. Let us know. Like, we are open to conversation.
Please.
We don't have all the answers. We are experts in what we know and in our experience, and as nurses, yes, absolutely. But we are 100%, everyone's experience is very different and very validated. And so we are definitely open to having honest conversations about something maybe you disagree with. And that's okay. We're allowed to disagree with each other.
And you and I don't know everything. Like you just said, we know what we know. We don't know everything. And I very much want to make sure on this podcast that anything we're putting out there is accurate. So if there's ever something I misspeak about or you misspeak about, I want to make sure to come back and correct it. Again, this is for providers too. Like, please give us feedback. Ashlee and I really want to make this a productive conversation for everybody. So whatever we can do to foster that, like, I think we're making it very clear, Ashlee. You and I want feedback, and we're very open to it. And we are not opposed to bad feedback, good feedback. Like, give it all to us. We need to hear it. It's going to make us better. And I think it's going to open up the conversation more.
Yeah, absolutely. I think this is us saying, I think our first episode, we shared our stories and we expounded on that, and we've gotten some great feedback from that. And I hope those listening to this have listened to that as well and found it helpful. But I think we were very vulnerable in that episode from a personal standpoint. I think this is us being very vulnerable from a professional standpoint of, we're putting ourselves out there and we're talking about things that I think a lot of like people don't want to talk about, and it's very hush hush. And I think a lot of people don't want to have, negative feedback or be contradicted, or especially, other, coaches or influencers or people on social media. Like, everybody claims to have all the answers, and they're selling you that this is going to fix everything and I have your solution. That's not the case. That's not what we're doing. We're human, and we have all this knowledge. We have all this experience. We have our own personal experiences and journeys that we talked about in the last episode. And we know that we can help people. That's ultimately what we are trying to do. We are wanting to just help people in their reproductive journey. We recognize there's a gap. We recognize that there's issues in the system. We recognize that there's so much misinformation out there. But we're coming and being very vulnerable and putting ourselves out there that, like, hey, we want to help people. We want to support you. But I think it's hard to have some of these conversations and say some of these things, because I think, again, what sort of sells on social media is, I've got this for you. I can fix this. Or, hey, I can do this and I'm going to solve all of your problems. And what we're saying is sometimes you just need more support. Sometimes you just need better education. And maybe it's more than that. And that's why we want to know that.
That's why we want to know. Yeah.
That we're trying to build something that is really, really valuable. And we can't do that without feedback from other people. If we just worked in our own little silo, we wouldn't be where we want to be.
No. And I think that's the beautiful thing about this collaboration between you and I is this is not competition. Like, I am not in competition with you. You are not in competition with me. There are going to be people who resonate with you, and there are going to be people who resonate with me. I don't really care. Find your village, right? Build your village. I think that's the take home message from this part of the episode, the end of the episode, is that I really just want people to build a community of support around themselves. And that's going to look different for everyone. That may include a therapist. It may include a coach. It may include an acupuncturist. It may include a naturopathic physician. It may, but build your village, like whatever you need. And I think, this is a conversation that I have all the time. We are very siloed in healthcare. Mm-hmm. We all work in our lanes. And we don't communicate with each other. And I think a lot of that, again, speaks to the broader system and the broken health insurance that we have. And health insurance says you got to do this and you can't do this, and we're not paying for that. Even though that's what's best for the patient, we're not going to pay for that because it costs money. But if we all were more open to working with each other, right? We don't have to be this. I see a lot of like Western medicine versus Eastern medicine. Why does it have to be that way?
Yeah. Why can't it coexist?
We both have great things to bring to the table.
Yeah.
If we collaborated, my gosh, we would solve so many problems. So much quicker. It doesn't need to be an either or. And I think, we talked about the nurses being the center of the clinic. We need to put the patients back in the center of this journey.
Yes.
And give them the tools that they need, regardless of what our personal biases are, right? Like, does that make sense?
Yes. No, I mean, I think that's a really powerful statement, is where the focus sometimes a lot is putting money into clinic, putting time and energy into clinic and all those pieces, which are great. Let's put time and energy back in the patient. Let's put money back into the patient. Let's give back to who we're really trying to help and support. Keep that number one and build from there. And I think we do that through having these conversations. I think we do that through collaborating like you and I are doing. And I think it's from feedback and from hearing and talking and having the hard conversations. And I hope that our listeners are just have just a better understanding of you and I, kind of where we're coming from, what we're trying to build. I think us as humans just really wanting to, and nurses, wanting to really help and support this community. That is obviously our broader goal in what we're trying to do from this podcast. Otherwise, that's what we're trying to get out there and do and be really loud about it. And so I hope our listeners feel that from us. I think that's the whole point of this episode is, we want to be open and transparent about what we experienced in the clinic so you have a better idea of it. Let's talk about the problems there and let's have conversations and collaborate. And the more voices that are out there, the better things are gonna become. I hope that's the goal.
Yeah. And I think Fertility Nurses Unfiltered, I think the more that you and I are unfiltered about things, even though it is the hard conversations, right, the quicker we get to solutions.
Yeah.
Even though it's hard.
That's why we named it this.
That's why we named it this. Yeah. There's going to be things that you and I talk about that are kind of scary to talk about or vulnerable to talk about. But I think it's necessary.
Yeah. So I hope our listeners, again, we would love to hear from you. If this resonated with you, please let us know. If you have comments, questions, feedback, you disagreed with us on anything or want to correct us on something, please let us know. We are absolutely open to having those conversations or correct ourselves on the next episode. But I really hope that this helped give you a sense of what's happening between the appointments, which is what this episode is called. What's happening between those appointments in the clinic, what you're experiencing at home because of it, and where the gap in the system really is, and hopefully what conversations like this do to improve, close that gap. And let's do better. Let's do better together.
Yeah. Awesome. All right. We'll end it on that. But if you enjoyed this episode, please like, subscribe, share, get it out there, because the more people that listen, I think, the louder our voices can be cohesively. I don't know if I'm using words right now. But the louder that we can be, like, the quicker that we're going to fix things. So please like, comment, share, whatever, email us, DM us, all the things, but we'll talk to you. We'll see you next week.
We'll see you next week.
If this conversation resonated, like, comment, or subscribe, share, send us your questions. Nothing is off limits.
And wherever you are in your journey, know this: you deserve support that's real and human. Never forget to ask your questions, advocate louder, and remember, you're not crazy. Fertility is hard.
That's it for today's episode of Fertility Nurses Unfiltered. Thanks for spending your time with us today.
We'll see you next time.